Do you remember the joys of childhood? The feeling of independence while building your first fort? Or the annual December dash towards a tree surrounded by presents? Your childhood has shaped you more than you may realize. But what if none of that happened? What if your childhood was interrupted by something traumatic? An event that most people won't talk about and honestly couldn't even fathom. Like early exposure to drugs or alcohol, being removed from your home because the living conditions just weren't safe. Or the unthinkable, childhood sexual abuse, or even being a victim of human trafficking. What if that child was you? Would you be sitting where you are right now? Not without help. Blank Children's Star Center provides the help children facing trauma need when they need it most. We aim to not only improve each child's health and well-being, we are committed to increasing their resiliency to cope with the trauma that no child should ever have to endure. But without our generous donors, thousands of children experiencing trauma may never be connected to the help they so desperately need.
We know from the Adverse Childhood Experiences research that toxic stress and trauma can have adverse impacts on a child's health and well-being into adulthood. We know that children exposed to multiple ACEs are 4 times as likely to suffer from cardiovascular disease. They may experience depression and anxiety at higher rates than the general population. We also know that children who have experienced 6 or more traumas or adverse childhood experiences can be 25 times more likely to attempt suicide. And what's really important to remember is that the behaviors that we see in these children, that's because of the trauma. It's not because these children are bad children. These children are great children. They just experience some bad things.
Our Central Iowa-based services are leading the way in trauma-informed care for children. And because of that, our services are in demand more than ever. Yet, this vital care would not exist without generous community and donor support. Every single dollar donated makes a huge impact in a child's life in so many ways. Our Child Advocacy Center is dedicated to providing a safe and neutral place for children to talk and receive exams when there have been allegations of abuse and neglect.
I've been a prosecutor for a long time, for 30 years. And 30 years ago, sometimes the police officers didn't know how to talk to the children. They didn't have the sensitivity that we've all learned to expect from the Star Center. So we probably would not be as successful in our cases because maybe some children would shy away from the style or the manner in which early investigations were done. And now this is an opportunity for the children to have a place that's friendly to them, understanding to them. It just is something that we've learned how important it is to have a center where children can come and feel comfortable and at ease.
It's sad that we need to have this resource available to us, but when you look at what they're doing to help the children who need these services, and also lighten the load a little bit on all the law enforcement agencies in the metro. So it's a tremendous benefit to the police departments because it, again, allows us to focus on what we're best at and then get the people who are best at their practices focusing on the victims.
The type of evidence that my office is looking for out of the Star Center is credible and reliable, detailed accounts by child abuse victims. And the specialties and professionals that are at the Star Center provide that level of clarity and credibility that we need in order to move forward in child abuse cases. Without that expertise, the interviews of traumatized children could be subject to being thrown out by the court. I cannot emphasize enough the importance of the Star Center. Children who've suffered abuse and trauma need to be able to tell their story in a way that we can use as law enforcement without continuous interviews that continue to re-traumatize them.
We even offer Iowa's cutest coworker, Lily, who is one of the only service dogs allowed to go to trial with children, so they don't have to face it alone. We also offer a trio of specialized clinics, such as the Drug and Endangered Children Clinic, which serves children who have been exposed to drugs and/or alcohol to provide the non-judgmental support they need.
12% of all the substance abuse-related child abuse and neglect reports to the Iowa Department of Human Services involved exposure to methamphetamine. We do have a terrible methamphetamine problem in our state to this day. The typical methamphetamine binge involves staying awake for 3 days and then sleeping for 3 days. So anyone who is trying to parent while using methamphetamine, once the usage has gotten to that point, is not available. And when children are born with or are exposed later to drugs in their environment or in their bodies, there are going to be consequences. We know that that can even lead to sex trafficking of children and getting the children purposely addicted to drugs so that they will do what the abuser wants.
Our Growth and Nutrition Clinic helps families provide nutrition to children who are malnourished or are just struggling with growth and weight gain. And a foster care clinic that provides multiple services that include medical care, behavioral health, school readiness, and care coordination for children removed from their homes.
I mean, there's all sorts of different forms of trauma, whether it's an inflicted physical injury or an emotional injury. And often we see children coming in to our center who have had neglect, physical injury, child sexual abuse, what have you. But what we see that they carry with them is the emotional component. That is really oftentimes what gives them their struggles and the things that they need the most help with. Well, we know that children in the foster care system are defined as children with special health care needs. 80% of them have some unmet medical or mental health need. And these are children who just need that extra time, that extra attention, the extra services that we can provide.
The foster parents in general get overwhelmed. A lot of people. I mean, we've been in it 4 years, but new people are coming in all the time. And when somebody is new to the foster care world, they're going to court. They're being required to do these doctor's visits. They might end up having to go to different specialists, and having that one spot is key for them because they're already running around everywhere. And to have one area to say, okay, we can take care of all the child's medical needs right here.
I honestly don't know if we would have stuck with it as long without having that specialty clinic. I think having them there as a resource and as a primary care for those kiddos has been extremely important for us.
Mm-hmm.
The only way an organization like Blank Children's Star Center can thrive is through a strong community backing. And the reason these services are leading the nation is because of the support that you could only receive in a place like Des Moines.
Yes, the foster care clinic at Blank is the first clinic of this kind in the state of Iowa. I would say the long-term payoff is having a center of excellence, a center of expertise for this very specific population of children who are children with special health care needs. And our goal, long-term goal, is to recreate this type of center, not just in the central Iowa, but throughout the state.
Think about the children that are close to you. Think about the kids that you love and care about. And if something bad happened to them, what kind of resource do you want available? And you're going to want the best that there is.
We can't end childhood trauma, but we can do everything we can to reduce its lasting impact.
When the abuse ends, childhood begins.